everyone, and happy fall. Finally, we can feel the fall weather and see the leaves changing. Homecoming is right around the corner, and students are really excited about that. But on a more serious note, a lot of people are worried about the clowns. I don't know why. We have something more important to talk about, lymphangitis. One of our representatives, Mr. Ben, is going to be talking with Dr. Gray about the disease.
Thanks, Mark. I have Dr. Gray here to talk to us about this disease we've been hearing so much about. How are you doing today?
Good, how are you?
Good, thanks.
Good.
So, what exactly can you tell us about lymphangitis?
Well, this disease is caused by the bacteria Streptococcus pyogenes, and it's a gram-positive cell. The bacteria has a round shape, and it uses bacterial F proteins, which attach to fibronectin receptors present in the host cell's epithelial layer. Streptococcus pyogenes has many other adhesins that aid in attachment to host cells. They like to hang up in the upper respiratory tract of humans as well as the skin.
Ugh, sounds like something I wouldn't want to have. What else can you tell us about it?
Well, humans contract Streptococcus pyogenes through droplets, which means when people sneeze and don't cover their mouth, you have a higher risk of getting this bacteria into your body.
Wow, that sounds awful. You know, it's really poor hygiene that seems to spread these diseases most often.
We have some great immune systems, but this disease releases enzymes such as DNase, hemolysins, and streptokinase, which cause tissue damage to the host cells. The tissue damage caused by these enzymes causes an inflammatory host response, and in addition to teichoic acids and peptidoglycans, which cause cytokine responses in hosts, that is additional inflammation.
Wow. So how did your patient contract this disease?
Hi, I'm Dr. Gray. How are you doing today?
Good. How are you?
Good. Are you having any symptoms?
I am. I feel like I might be getting sick. I have this red streak on my neck, and I'm not sure where or how I even got it.
How long have you had it?
I think about 2 weeks now.
All right. I'm going to take a look at it, okay?
Okay.
So it looks like your lymph nodes are really swollen.
Oh, really? What's going on with me, Doc?
Well, I think you might have contracted lymphangitis through the cut on your neck, and there's some tests that I can run to make sure that that's what happened.
So what exactly are you going to do to me?
I'm going to draw some blood, and then I can take some tissue from your lymph node and run some tests on that.
Okay.
I'll probably look at it under a microscope and see if it matches up with all the symptoms for lymphangitis.
So is there a cure? Am I going to die?
You're not going to die. I can prescribe you some antibiotics like penicillin, erythromycin, or clindamycin. And if you have pain from the swelling, I can give you some ibuprofen or pain medication. My patient had a cut on her neck, and that's how the bacteria made its way inside her body and targeted the lymphatic system.
What kind of symptoms did you see in your patient?
Well, initially there was a red mark on her neck as well as swollen lymph glands and a fever. There's also loss of appetite common with this disease.
Speaking of appetite, I could use a snack. Let's go to commercial break.
So that's why I learned how to train possums.
Now sweet's coming out the bushes. For listening to Donna drone on, you deserve the sweet treat of a Diet Dr. Pepper.
That is sweet.
How sweet.
I don't know.
Honey, who are you talking to?
It's no one!
That's right. He didn't listen to Donna. You did.
I can see you talking to a little man.
Okay, it's a little sweet.
Hey, man. Diet Dr. Pepper. It's the sweet one.
Oh, right. How do you treat this disease?
I usually prescribe penicillin or clindamycin for those that are allergic to penicillin. And the reason I do that is because the drug reversibly binds to the 50S ribosomal subunits, and it prevents peptide bond formation and inhibits protein synthesis.
I definitely would not want to be a Streptococcus pyogenes. How can we avoid getting this?
Well, if you take this dose around 21 milligrams per kilogram per day for every 8 hours for 10 days, it usually treats it. And it's important to wash your hands, especially with the winter coming up, and also being crowded in rooms together, and avoid people with Streptococcus pyogenes.
All right. Well, thank you very much for your time, Dr. Craig. And we will be back with the weather at 7.